I'm the health education coordinator here at the Student Health Center. I've been the coordinator for a little over 9 years, and prior to that I was a health educator, just working a lot in nutrition, and we were very segregated, sexual health and nutrition, and so I did a lot of the nutrition work for about 3 years. And then prior to that, I was a graduate assistant, so all here at the Student Health Center. I have a bachelor's degree in health. I have a master's degree in health education, and I'm almost through with my doctoral degree in health education, all from Texas A&M Department of Health and Kinesiology. I feel like the master's degree, it trained me really good for a health educator position, but I really think the PhD has trained me and made me a better coordinator. It's allowed me to kind of look at health education more from the academic side and the research, and look more at what we do here as far as evidence-based and making sure that we're doing theory-driven programming and activities, and we're really trying to change our strategy and our strategic plan for the next few years from awareness events to more research, more data-driven programs, rather than just, hey, we did a great 5K for 120 people and then that's it. So we want to focus more on behavior change and more skill building for students, and I think the education that I have has really helped me to be able to do that. Well, I serve on a lot of committees at the division level. I serve on an assessment team, and so for example, my Monday, this coming Monday after Thanksgiving, I have a 9 o'clock meeting for one committee, which is an eating disorders interdisciplinary team committee. I'm the health educator on that committee, along with a dietitian, a counselor, and a physician. And then I'm helping Dr. Miller actually with some interviews, PJ Miller, for her class. And then I also serve on a task force that's developing student learning outcomes for student employees that work in the division, so that we can have just I guess across the board same learning outcomes for student employees that if they have a division job. And then I also, like I said, I mentioned I serve on an assessment team, so that meeting's also Monday. So a lot of my days are filled with meetings. I'm also on a wellness community, I guess a coalition where we meet and we talk about things for our wellness community that we've created in the last couple of years. So that's a lot of my days or meetings. At the coordinator level, that's what you do a lot with administrators. Other days I do presentations in classrooms as guest lecturer. And then, like I mentioned earlier, we do awareness events, so I spend time planning those events too. I love working with students. That's why I'm still here. I'm a consummate student. My mom tells me that she sent me up here to go to school in 1993 and I never came home. Yeah, and getting new students all the time. You know, the behaviors are the same, which is a little frustrating at times, which might be one of the things that I struggle with, is the behaviors are the same. It's like shaking them. Like, okay, just stop doing those behaviors. Stop engaging in risky sex and drinking while you're doing it. But getting a new batch of students and just seeing the evolution of students from where they're just more engaged now, and they're more looking at learning outcomes, and trying everything that they do, they're trying to learn something from it that they can apply in their futures, careers. And one of the things that we struggle with in this particular campus is a lot of the sexual health education that we try to give to students. We get a lot of pushback. I'm actually working on a qualitative study right now for one of my classes, interviewing health educators at a private institution and a public institution and seeing the differences. And so far I've done the private one, and there hasn't been a whole lot of pushback from students at that one. It's not a religious institution, it's just a private school. And I haven't done the public one yet, but it's A&M, of course, so I'm curious to see what the differences are. So we get a lot, and not just from students, from administrators too, which is a struggle sometimes.